Going live in 5.
Welcome to Pacific College of Health and Science YouTube presentation, Cheek to Cheek with Dr. Shellie Goldstein. Dr. Goldstein is head of our FACE certificate program here at Pacific College, Facial Applications for Cosmetic Enhancements, which also features Mary Elizabeth Wakefield, Matt Callison, Michelle Gellis, Deirdre Courtney, and Carrie Hart. Dr. Goldstein is widely considered one of the worldwide experts on cosmetic facial acupuncture. She's the author of Your Best Face Now, Look Younger in 20 Days with the Do-It-Yourself Acupressure Facelift, and she's creator of the Touch and Glow Do-It-Yourself Acupressure Facelift Kit. Dr. Goldstein has been featured on many major television and cable networks, in the press many times, and is also a columnist for Acupuncture Today News. You can put your questions in the chat tonight, and we'll get those to Shellie for the Q&A, which will be at the end of her talk. Please welcome Dr. Shellie Goldstein.
Hi, everyone. Thank you so much for coming tonight. And thank you so much to the Pacific College of Health and Science and to Cynthia and everyone that helped to make this possible. Really, really appreciate it. And this is going to be a fun hour. So sit back and enjoy it. We're going to talk about cosmetic acupuncture. We're going to talk about aging, and we're going to focus on the cheek area, which is one of the major places that we see the aging as we mature. From a Western medicine perspective, we say that aging is a biological process resulting from the gradual reduction in structural components and cell function. When you're young, your face has normal volume, it's well-defined, it's well-contoured. We'll look at some photographs in a moment. But then as we age, we start to see some changes. The regional facial aesthetic units start to change. And this is mainly due to a number of factors according to Western medicine, notably resorption into the bone and the fat tissue, muscle attenuation, skin thinning, skin plasticity and elastosis, and repositioning of the ligaments that sustain soft tissue. So don't worry if you are not sure what I'm talking about, we're going to go through it today. From a facial acupuncture perspective, according to Chinese medicine, it's a little slightly different. We're looking at the changes that are influenced by the balance of yin, yang, qi, blood fluids, the meridians, the zangfu organs, and their systems. So today what we're going to do is we're going to go through briefly the anatomical changes that you'll see, and then how to, with Chinese medicine and acupuncture, make significant changes, particularly in the cheek area. And we'll see one very easy treatment that you can do at starting tomorrow in your facial acupuncture practice, or if you have not practiced facial acupuncture, you can still do it. First off to know is that when you are looking at the face, there's the vertical planes and the horizontal planes. So from a horizontal perspective, we look at the top of the face being from the top of the hairline to the inner canthus plane. Some people say it's at the eyebrow, some people say it's slightly lower. And then the mid face is from this intercanthus plane to the subnasal, right below the nose. And then the lower face is comprised of from the subnasal to the menton, or the chin area. On a vertical plane, we start with a vertical center line right here running through the center of the face. And then the next moving outward in a vertical position, we see the second line is at the center of the pupil, running again from the top of the head to the menton. And then the third layering, outside layering, and that vertical position runs at the level of the earlobe. So this is the width of the face moving from the lower earlobe straight out towards the other earlobe. And then again, we are focusing on that intercanthus plane to the subnalis, and then from the center of the pupil, vertical line, center of the pupil, lower earlobe, this whole section of the face. Now, as we look at different ethnic groups, there are some changes that occur. So for example, in a Caucasian face, the nasal base is a little bit larger or a little bit narrower. The tip of the nose is a little bit more wider, a little more projected. The intercanthal width is identical to, say, African faces, although the lips are fairly narrow and have less volume, as opposed to, say, an Eastern Asian face, which has a weaker facial skeletal framework, wider, rounder face, higher eyebrows, fuller upper lid, lower nasal bridge, with horizontal flaring at the nasal ally right here at the nose area, flattening malar prominence right here. This is the malar prominence along here on the Asian face. And then more turbulent lips and a receded chin. Now moving to the Latino or the Hispanic face in the lower left-hand corner, there's the increase by zygomatic distance. That's the distance between the cheekbones, broader nose, rounder face, and a more receded chin. So it's a little more pushed back as opposed to, say, the African-American face, which has a much broader nasal base, a decreased nasal projection, the bimaxillary protrusion. This is right in here, this area. And then the nose is broader, the face is rounded, and it's much more, the lips are more prominent, and there's increased facial convexity. So there's, no matter the change, the aging process is somewhat similar in that as a face in a younger face, the weight of the face going from that horizontal positioning, the weight of the face is more distant, so it's more towards the edge of the latter part of that vertical aspect, and the eyes are more open, forehead is a little bit wider, but this whole mid-face area is a little bit wider, a little bigger, and as we age, it starts to drop. So the mid-face really begins to drop into the lower face, and what you see is a change in the nasolabial fold, or this deepening of this fold from the nose to the corner of the mouth, as is for the mental crease, or right in here from the corner of the mouth to the chin area. And there's a flattening of the face that occurs. So wide open mid-face in the younger years, and a flattening, dropping mid-face as we age. A number of those regional facial aesthetic units, as they change on multiple levels. So it changes at the level of the bone, the muscle, the fat, and the skin. And without spending too much time on this, just to help you understand, here, this is a younger face, this is an older skeleton. And as you see, when the face starts to age, the whole height of this face starts to drop. The eye sockets start to expand, the bone starts to break away at the edges. The temporal area right in here starts to hollow. The nasal piriform right in here starts to widen. Again, the bone is resorbing. The mandible and the maxilla, you can see the change. This is the mandible. You can start to see the change. It starts to get smaller and longer, as does the maxilla area. And when that happens, it pushes the teeth. There's not enough room for the teeth to fit into the mouth. And so they start to then push forward. And the entire facial skull, or the skeleton, starts to push forward and jut out as in a protruding position. When this happens, you can see the entire tissue, all of the tissue that's on top of the skeleton starts to change too. So the skull is kind of your foundation, it's your base, and as that starts to change, it creates changes inherently in the tissue, and then the tissue itself starts to change too. So on top of the skeleton, we have, unique to the face, we have two sets of muscles. We have the deeper craniofacial muscles right in here in the cheek area. They attach from bone to bone, or bone to muscle. So here is the buccinator, and then you have the medial and the lateral pterygoids, and they primarily move the jaw. This is their primary function, is to connect from the maxilla to the mandible and help to move the jaw, particularly in terms of chewing. And then this is unique to the face. We have a set of muscles called the craniofacial or the superficial mimetic muscles. Now these muscles are attached not from bone to bone or attachment, but they're attached from bone to muscle to muscle, and muscle to skin. So rather than moving bones, they're going to move other muscles in skin. And these, we call them the mimetic, meaning expression. So they are going to create all of the expressions that we create on our face. And they're all attached. And what's important to note for the midface is that all of these facial muscles, you have your levators that lift and the depressors that pull down. All of these midface muscles are attached from the orbicularis oculi, the muscle around the eye, to the orbicularis oris. And this is going to be very important when we move into treatment, is to note that we can very effectively and very efficiently treat the midface just by treating the area around the mouth to affect all of these levators, the muscles of the mid-cheek area. You can see these muscles, they're very flat, very striated. As they age, look what happens. Rather than being spread out and nice and moist and ability to contract, they start to stiffen, they start to separate and start to dry out. So that's going to affect our aging face as well. And then on top of the muscles, we have 3 layers of skin noted as the integumentary system. We have the fat layer, which is the layer that sits on top of the muscles. The mid layer is the dermis, and this establishes the health of the skin cells. And then on top is the very superficial layer. And this is what you see when you look at your face, either in the mirror or somebody else's. The epidermal layer, the dermal layer, and the subcutaneous layer. And as we change inherent to skin changes, we start to lose, most of the changes occur in this dermal layer, the health of the cell. We lose vascularization, collagen and elastin starts to break down. This layering between the dermis and the epidermis right here starts to thin out. When this happens, along with the disorganization and the loss of collagen and elastin fibers in the dermal layer, we start to see some pitting and some drooping in the superficial areas of the epidermis. And then with the reduced vascular tissue, just the health and integrity of the dermal layer and the upper layers of the tissue start to disintegrate. All of these layers run in a horizontal plane. Running in the vertical plane, we have retaining ligaments. And these are like little plugs that help to keep all of this tissue in place. So they're called retaining ligaments. They're strategically placed throughout the face, most of them being in the mid-face, along here, along the zygomatic ridge, along in here. And think of this, as the bone starts to change, as the tissues start to change, and as the skin starts to thin and change, what the ligaments that are holding everything in place also start to change too. They start to reposition and they fall more medially into that medial plane, and they start to also get a little bit dry. And when this happens, we start to, again, to see everything pushing in the middle, so a deepening in the nasolabial fold and in the marionette lines. So this is what it looks like, folks. Here's a younger face, and this is a frontal, and then at a slight angle, and then more at a side view. And you can see the visible changes. You can see the young face, and you can start to see, as it's changed, you can start to see the floating of the projection of the face, moving from nice and open and wide, starting to move in and drop down and creating these folds in the cheek area, loss of definition in the jaw area, and then it just continues over time. So what we are going to do is learn how to, very simply, just to help lift this area and reposition the tissue of healthy skin. So here it is. When you are looking at this image, here is actually the first one is the older face, or you can actually see that nasolabial fold. You can see the mental crease as opposed to, say, in younger years. Do you see the difference? Do you see the widening of the face, the lifting of the face? And so the weight of the face is up here, as opposed to when we start to age, the weight of the face starts to move down out of the mid-cheek area and into the lower face. So here's a test. Okay, take a look at these, and I'm going to ask you which of these faces looks like the younger face. Now, I'm not going to be able to hear your answer, but I'm just going to have you just take a look. Here's a face. Take a look at the mid face in particular, right in here. Here is the second image. And if you said E is the younger face, you're right. Here's another one. Here's A, looks like this. B looks like this. So again, taking a look at the mid-face area and the weight of the face. Is it open across the top, or is that weight starting to fall? Here's the second one. Here's the weight of the face. Where is it? Is it here or is it here? If you said the younger face is B, you're correct. Here's the third one. Okay, one more time. Which of these faces is the younger looking face? Is it this one or is it this one? Again, what we're doing is you're looking at the mid face, you're looking at the openness, you're looking at the width of the mid face and the height of the mid face right in here. And you are also looking at the weight of the face as it changes. Is it moving down? Is the face flattening or is it staying wide? So the younger face is going to have a higher cheekbones, wider face, minimized nasolabial fold, and marionette line. So if you said B is the younger face, you're right again. Great. Okay, now here's the trick. For today's presentation, what we're going to do is we're going to look at the tissue that is connecting from the bone to the surface of the skin. And that tissue that connects all of the layers, both in terms of the horizontal plane and the vertical plane, is known as fascia. And fascia is a form of connective tissue. It is the most abundant connective tissue in the body, and it's composed of bundles of collagen fibers. And on the face, there are two types of fascia. There's deep fascia. Deep fascia starts at the covering of the bone, the periosteum, and it encapsulates and surrounds all of the muscles, the blood vessels. So it's primarily a way of compartmentalizing and protecting all of those layers. So remembering the bone is the deeper layer, then muscles, then the integumentary system, which is the fat, the dermal layer, and the epidermal layer. So in the face, that deep fascia encapsulates all of the deep muscles that we talked about, the buccinator, the pterygoid muscles, and all in the mid-cheek area. Now, also unique to the face, there is superficial fascia. That superficial fascia is not so much designed to encapsulate muscles or nerves or vessels, but rather to connect. So it's located on top of the muscles, and it goes from the muscles to the skin. And its job is, as muscles contract, it actually moves the skin and other muscles. So all of the expressions that we make, when we talk, when we listen, when we have feelings or emotions, maybe our eyes open up, our brows furrow, we smile, we cry, all of those expressions are dictated by the movement of the mimetic muscles being supported and connected to the skin by that superficial fascia. We used to think that fascia and connective tissue was like a thin layer, say like a saran wrap or something like that. So it's just this thin layer of tissue that kind of sticks the muscles to the skin, or sticks around the muscles and the deeper areas. But in fact, what we're starting to find out, and this is due to the work of Thies and Benias in 2018, so it's pretty recent. What happened was they started looking at tissue, particularly in the pleural area around the lungs, and they started noticing that instead of it being a flat tissue, it actually has fluid-filled spaces. So there's a fluidity to it. So if you look at the top layer, it looks almost like a flat tissue, but then if you magnetize it by 40 times, you can actually see some spaces in between. So it's not really like sticky film or saran wrap, but it's more of a gelatinous type of tissue with spaces in between. And it's noted that all of this fascia or connective tissue runs throughout the body, and it's possible that the therapeutic efficacy of acupuncture may be linked to that interstitial structure and properties. So what happens? We see that when you insert the needle into the tissue, in one study, the authors proposed a model of anatomical and physiological equivalence, and they're calling it fasciology. And they're relating it to the principles, our principles of yin and yang, meridians, acupuncture points, chi and movement, everything that's related to our world. And when you are inserting that tissue, the needle into that tissue at varying levels, so into the skin, into that superficial or adipose layer, in through the superficial fascia, into deep adipose, into deep fascia, and into the muscle. So dependent upon the layer, so the depth of insertion, you create that chi sensation, or that spreading sensation, the da chi, that we experience when we are inserting the needle. And so the actual insertion of the needle through that tissue and into the connective tissue, which is connecting all of the other structures to one another, that spreading, or that chi area, travels through the connective tissue and creates the therapeutic effectiveness of acupuncture. One theory, right? However, what's particularly interesting to me about this is we've been hearing about the connective tissue even in the Ling Shu. So the Ling Shu says that throughout the ancient texts, there are numerous discussions about needling guidelines specific to the layers of the skin, the flesh, the area between the flesh. There's the connective tissue and the fascia, in the channels and around the muscles and at the level of the bone. And it goes on to say in chapter 1, the skin, the flesh, the muscles, the tendons, and the meridians occupy different places in the body, and that different diseases respond to different methods of treatment. And if illness is superficial and the needling is deep, it will penetrate and injure the good flesh. If illness is deep and needling is superficial, results will not be obtained. So the level of penetration, or the depth of needling, is significant when you are treating in general, but specifically to the aging phase. So let's take a look. So if you are needling into the epidermis or the dermis of the superficial tissue, you're going to angle this needle. And when we talk about angle of insertion, we're talking about it being relative to the surface of the skin. So a superficial needling is going to be very, very superficial to the skin, almost at a 5 to 15 degrees, so such that the needle may even fall on the surface, similar to Japanese needling techniques. If we are needling into the hypodermis, it's going to be a little bit more angled because you need to get in slightly deeper, still being into that superficial tissue. If you are going into the mimetic muscles or the superficial tissue, at the angle, you will be needling into 45 to 60 degrees. And then if you want to get into the deeper muscles, into the deep tissue or into the bone area, you're going to needle a 9-degree angle. So whatever your intention is going to be affected by, and the efficacy of your treatment is going to be affected by that angling of the needle relative to the depth of insertion and the tissue that you're trying to affect. in the mid face, we tend to needle a little more deeply into either the muscle area, but in this situation, and this is one needling strategy that I've used, needling in the lower face and the neck area into the muscles to affect the muscles, possibly, around the stomach 9 area deeper because of the location of that point. Mid face more deep into the meridians, whereas on the upper face, we're needling more into the muscle area and very shallow needling across the forehead, primarily because this tissue layering is so shallow. The deep muscles are here. They're in the cheek area. So you don't have deep muscles in the forehead. They're right in the cheek area. And therefore, if we want to affect those deeper muscles, we need to needle a little bit more deeply. And in order to obtain the proper stimulation that we're going to get by needling the muscles and then having that move through the fascia or the connective tissue, we're going to move a little bit more deeply. Now, one thing to remember with facial acupuncture, for those of you who practice cosmetic facial acupuncture, this is not new, but we also, people who are not familiar with it think, okay, we're just going to put some needles in the face, but that's not the case. We really are practicing Chinese medicine, and we are knowing that those facial concerns, whether it's wrinkles or sagging skin or lifting muscle tone, these are the symptoms of an underlying pattern of disharmony. And in order to have an effective treatment, you need to treat what's underneath. You need to treat the root cause or the underlying cause, and you will determine that from your tongue, your pulse, your diagnostics. So you're going to treat those, the underlying pattern of disharmony, with body points, and then you're going to treat the branch or the symptoms, the wrinkles, the skin sagging, the loss of muscle tone, with the corresponding face points. So here we go. We know that the young meridians traverse the face, and particularly weighted in the mid-face area. So you'll do your patterns of disharmony. You'll treat the underlying condition with body points, and notably, we see that the primary meridians or organ systems that run in the mid-face is the stomach. You can see the stomach meridian running right through the mid-face, and also innervated to some area by the large intestine, but more by the small intestine. So we're looking at stomach meridian, small intestines. These are the primary areas that run through the mid-face. And interestingly enough, when we think about muscles and muscle tone in Chinese medicine, we're looking at the system of the spleen. So it makes sense. When we are treating the face, the mid-face, remember I said that all of the muscles of the mid-face attach, either insert or originate at the orbicularis oris, the muscle around the mouth, or the orbicularis oculi. So all of the mid-face muscles, superficial muscles, are attaching to one or the other. And the deeper muscles run underneath. So this is called the modiolus, and this area, it's approximately at stomach 4. It's a chiasma of all of these facial muscles that are held together by this, the modiolus, which is a fibrous tissue. You can find it on yourself. I don't know if your fingers are clean or not, but you can just take your fingers and stick them in your mouth and feel for a little knot in the corner of your mouth. You just put your fingers in there, feel around, and there'll be a little knot at approximately the stomach 4 area. When this attachment or this chiasma is really important in terms of helping the muscles that are attached to it. All of these muscles both move the mouth and create facial expressions. It's right here. You can see it. Here are all of the muscles around the upper muscles of the mid-face, as well as some of the lower face muscles right in there. And on the face, it connects all of the upper face muscles, and by name, there's the orbicularis oris, the orbicularis oculi, the buccinator was one of the deep muscles, and then everything that says levator or the mid-face muscles, depressors pulled down, all of these pulling on this, this modiolus, and you can see it right here. Now, because this is an attachment or a floating attachment, it is affected by the movement of all of the muscles that attach to it, right? So it's not a stationary attachment, it moves. So dependent upon your facial expression, it's going to change. So in a neutral position, it's going to be just on this particular model. It was slightly lower than the stomach 4 area. And when this model smiles, now you can see this modiolus, it's right at the stomach 4 area. And when the model frowns, it starts to move down, and then tightening the cheeks, pinching the lips together, pursing lips together, it's going to move too. So you can sometimes see it, but you can certainly feel it with a little bit of pressure, either at the surface of the skin or by having the patient take their fingers and place it underneath the tissue, or with a finger cut or a glove, you can do the same and find that little knot of tissue. So I'm going to show you a demonstration of a treatment. This was done with my model. We used Serin J15 #1 needles. In a normal treatment, what I would have done, what I would have discovered her patterns of disharmony, done my full intake. But in this situation, we just did it as a demonstration for you. I located the modiolus, needled it, and then we're going to do stomach 3, small intestine 18, stomach 7. Angle of insertion was at 90 degrees. Depth of insertion was 0.4 to 0.5 inches. And then I'm going to show you how I rotated the needle with the intention of lifting the corner of the mouth. Now, what does that do? Remember, modiolus is right here. All of the muscles, the levator muscles of the mid-face are here, running from the mouth area to the eye area. So if you lift the corner of the mouth, what you're actually doing is you're tightening those muscles and pulling back, remembering that the face, as we age, starts to pull more medially and drop down. So just by lifting in the corner of the mouth, you can actually pull back the corner of the mouth and elevate the lips. So we're going to show you this. Okay, today we're going to demonstrate the modiolus and lifting of the corner of the mouth. So the modiolus is located approximately at stomach 4 right here, but that point changes as the facial expressions change. So if you can just close your mouth for me, that's right, and kind of frown a little bit. Yeah, so here you can see the modiolus right here. And now smile. Yeah, and here it is up here, that's great. And straight, and now it's located right in here. So we're gonna go ahead and needle points. And we're going to start with approximately at the stomach 4 location into the modiolus. And I'm going at a 90-degree angle. And stomach 4 to 3. Small intestine 18. And stomach 7. And in this situation, the intention is to wrap the needle around the muscle fibers. I'm going to work
turn this counterclockwise. Tell me that when you feel a little tightening inside. Feel that? Okay, good. And then I'm going to wrap this one too. And if we, yep, there you go, good. And then, Great. And now as we twist this, we get the corner of the mouth to start to lift. There we go. There we go. Can you see the corner of the mouth lifting? Okay, you can see it's getting wider, a little bit wider, and a little more lifted. Okay. And this, when we started, was the lower corner of the mouth. And now if you come center, you can see it's actually a little bit wider, longer, and now at the corner of the mouth is actually higher. So.
And then we did the other side. Whoops, sorry.
Okay, and on this side, we're going to needle into the dilus. So on this side is slightly lateral to the stomach core point. And stomach 3. Small intestine 18. And stomach 7. Okay. And now we're going to twist in a counterclockwise. Good. Okay, I'm going to work them a little bit. And I can feel in the needle the fibers tightening around the points. Get this corner to lift. Okay. There we go. And you can see that her lips are getting wider, and her lips are getting softer and wider, and the corner of the mouth is starting to elevate. Good. That came fast.
So normally we would retain the needles in for 20 to 30 minutes. This is the entire length of the treatment. I just put the needles in one side, put them in the other, took them out, and then we're measuring. So before, this is the before picture, and you can see the line of the mid-face area, and the corner of her mouth is here on the left and at the line on the right. And then after the 3 and 5 minutes, it has moved up a little bit more and then above the line. And then when you measure them, here's the mid-face area, the height on the lower side. This height from here to here was 2.13 inches. And then afterwards, it has gone shortened by 1/10 of an inch. And then on the higher side, at the length from here to here was 2.09 inches. And then after 3 minutes, it went to 1.97. So this, although this is a small difference, the point being that when you can affect the muscle changes by needling through to the muscle layer, superficial and deep muscle layer, turn it so that you get that sensation through the connective tissue, through the fascia. You can elevate the corners of the mouth. By elevating the corner of the mouth, you are actually tightening and lifting the midface, pulling it back so that you again start to retain that lifted cheek area, wide face, and open mouth and tighter cheeks. And if you generally, what we do is we treat our patients for a minimum of 10 treatments. And you can see a huge difference in the mid-face area. Now, obviously, that's not the only technique that I use. There are so many different techniques that you can use, but this is certainly one of them that's very fast, very effective, very efficient. If you don't know what else to do in your treatment, if you're just starting out and you want to do a big wow treatment, this is the one to do. But you can certainly, as you can see in her before area, in her before photo, you can see the flattening of the cheek area. You can see the weight of her faces at the jaw area. You can see a deepening at the modiolus. You can start to see it's a little puffy and pouty in here. And as we continue to treat, her jawline starts to change. And with that jawline change, you can see the entire mid-face is much more open, much more lifted, much wider. You can see the cheek area, the zygomatic area much more prominently, and she looks so much younger. So for those of you who are interested in facial acupuncture or learning more, I'm so pleased to announce that the Academy of Advanced Cosmetic Facial Acupuncture, which was the program that I started, we just partnered with the Pacific College of Health and Science to present facial applications for cosmetic enhancement. We call it the FACE program. And what's unique about this program is it's so many different experts techniques. So it's not just me, it's not just one person. You're not just learning one skill set, but you're learning skills from people who are the well-known people today in our circuit and in the facial acupuncture world and in the acupuncture world. So Matt Callison, Mary Elizabeth Wakefield, Deirdre Courtney, Michelle Gellis, Carrie Hart, all experts in the field with so much information and different information. And that's what we love about this program, is we're bringing to you different people's takes on how to treat faces and ideas and strategies and treatments, so that you can learn as much as you can about them and then incorporate them into your practice so that you become tomorrow's leader. So for those of you who are interested and would like more information, we actually have this Friday on December the 10th at 11 a.m. Eastern Time. Wait, something's wrong here. We're going to correct that. Here's the link to the presentation. And Cynthia, can you come on and correct that time for me? I'm so sorry. Are you there? Well,
yeah, we'll get you the corrected time, and I think it's about 1:30 or 2 in the afternoon, but we'll look it up.
Yeah, it's 2 p.m. Eastern time and 11 a.m. PT time. So I have this totally backwards, sorry. But anyway, if you want to learn more, here's the link to it. And that's all I have to say. So thank you. So I would love to open this up and answer any of the questions that you might have. This is an opportunity for you to get your questions answered, and I'm happy to do that. So I'm going to stop sharing my screen.
Okay, and Shellie, you have some questions now in your chat that you can check on.
Okay, great, thank you. All right. What's the age difference between the ages, different skulls, and oh, great, good question. So the first person was probably in her 30s, something like that. And the second one was over 60, probably in late 60s, early 70s, something like that. So you can start to see there are significant changes over time, and they generally start in the, the latter half of one's life. Anything we can do to prevent aging besides not making expressions and acupuncture. Just recently, I gave a presentation on the emotional relationship between facial aging and wrinkles. And really, we know that as professionals of facial acupuncture, that we're not just treating our patients on the physical level, we're treating them on their emotional level, on their psychological level as well. And oftentimes unresolved issues will show up on the face. So, and those wrinkles or those creases or those changes that we see are very relative to our organ systems and the 5 elements. So for example, the forehead area between the eyebrows is related to the liver system. The cheek area is related to the lungs and the large intestine area. The jaw, end of the jaw is related to the kidneys, mouth, spleen, and pancreas. And so helping people on an emotional level is extraordinarily helpful too. Diet is very helpful, but also helping people just to feel good about who they are at any level is important. And that's what one of the wonderful things that our medicine has to offer. Also, things like microcurrent, LED, facial gua sha, facial cupping are all really good tools as well. How do you avoid bruising? Oh gosh, yes, stomach 3 and 4. So we did a piece at the Pacific Symposium about that. And really for bruising, there are so many capillaries in fine vessels in the face. It's hard to not bruise. You get better with practice. However, it will happen. And so great lighting. You can apply topical arnica on the area, really learn your vessels of the face and where they are located. Stomach 3, stomach 4, but also stomach 7. So under the parotid gland, there are a lot of vessels. You can't see them. Small intestine 18. So use great lighting, apply arnica, have a cold compress of some sort, just in case you see it swelling or bruising, and then help them with lymph drainage to get through the bruising process if in fact you do create a bruise. In the video are those the green or the blue. They are the dark green serums, 0.5 half inch. What does twisting of the needle in the video do? Which ways are the needles rotating? Are there ways to address neck sagging also, and double chin? All really good questions. The twisting of the needle is actually designed to catch the fibers, the muscle fibers, and then to send that, the chi, even though you're not really feeling the chi or the spreading, well, you actually do feel the spreading. So when I was talking to my patient, I was saying, do you feel this? This is what I was referring to. So she should feel, or your patient should feel, as you rotate the needle, you are engaging the muscle fibers and creating that spreading sensation through the fascia and connective tissue. There are many ways to address neck sagging and double chins. That's the lower aspect of the face. And then in other presentations, I'm happy to address them. But right, this one, we're actually just focusing on the cheeks. But there are so many wonderful treatments for the upper face, the mid face, and the lower face and the neck. Rotation of the needle. So some people say rotate clockwise, some people say counterclockwise, some people say clockwise to tone, counterclockwise to disperse. What I did with her is, what I wanted to feel was the needle engaging in the underneath the surface of the skin. So I started rotating in a clockwise position. I wasn't feeling anything. So on her, a counterclockwise rotation is where I got that engaging. You should feel, it should feel like a little tightening, as if you're, when you screw something into the wall, when it catches, it's a little bit harder to screw it in. You want to get that grab to help spread the sensation through the tissue. Any contraindications if someone is using dermal fillers? Absolutely. When your patient has dermal fillers, you should wait at least 3 weeks before treating your patient. You want that filler to mold and to take shape before you get in there and start playing around with it. Would you ever consider using non-coated needles to get more grab? Yes, you can absolutely do that. I just find that the Serin needles, there are 3 needles that I like: Serins, the Nano DBCs, and then AccuFast needles. Those are my 3 faves. And the reason, and the AccuFast and the DBCs are not coated, I just find that on my patients, even though they're coming to me for facial acupuncture, they don't really like needles in their face, and their tolerance for numbers of insertion is limited. So I think I get more out of it when I use the serums, but you can use whatever works best for you. And do I generally prefer to use tubes? Sometimes I like tubes if I'm going into a specific point, and so I contacted or found the medulus. I wanted to hold on to it, so I put the tube on top. However, if I'm using intradermals or something that requires a much more superficial or insertion, then I probably won't use a tube. Can you tell us more about how fasciology has informed your practice? Also, can we needle right into the vertical lines in between the eyebrow region? Yes, do we needle upward? Okay, these are good questions. I'm going to break it up. So I'm going to, how fasciology has informed my practice, it's just broadened the horizons of possibility for me. Understanding how as you can tell, or those of you who have studied with me, I'm fascinated by the anatomical changes in the Western physiology and morphology of the face. And so understanding as much as I can about the face is very important for me. Just as a specialist in a particular field, I want to know about it, as much about it as I can, from a multitude of perspectives. And in terms of, can we needle right into the vertical lines? Of course, yes, you certainly can. It's between the eyebrow region or in other face lines. Absolutely. When you are needling directly into the creasing, what you are doing is creating a microtrauma underneath the surface of the skin. The microtrauma helps the body to produce healthy collagen and elastin in that area. In most of the areas where there's creasing, you have a breakdown of collagen and elastin. So similar to microneedling, for those of you who are familiar with that, you want to create a microtrauma in the surface of the skin to create that massive healthy production of collagen and elastin, and needling directly into the crease will help you do that. And you can needle at the depth of the crease, or you can cross hatch into the walls of the crease as well, in order to stimulate collagen and elastin production on multiple levels. So this is talking about direction. Do we needle upward or in terms of the eyebrows? It depends upon your intention. There is, depending upon the intention of what you're trying to accomplish, will determine the depth of insertion and the angle of insertion. How often should treatments be done? Good. Generally, we say weekly treatments for at least 10 weeks and then reevaluate. That being said, again, what you're doing is, remember that you are treating the underlying conditions of your patient. So based on your analysis, tongue, pulse, and diagnostics, depending upon the patient, you may, if there's a lot of deficiency, you may want to give them some acupuncture before starting facial acupuncture. You may need to treat them longer if there's a lot of deficiency. On the other hand, if someone is young, they're coming for prevention, they may be able to get away with every 10 days. You want to build on your progress. So you want them to come back before the changes have gone backwards. Think of it as taking your face to the gym. We build the muscles of our body when we go to the gym. If you go once a month, you're really not getting the benefits of going to the gym, right? If you go twice a week or 3 times a week or once a week, you'll still get the benefits. And then as you build on the benefits, then you get more and more improvement. It's the same thing. We are taking people's face to the gym. So.
Shellie, it looks like that's it for questions. So if nobody else has any more questions, we're going to say thank you so much. This was truly wonderful. Thank you also to Dexter and L.C, our tech team, and to Natalie Tarot and the marketing team, and all who helped make this happen. If you're interested in the FACE certificate program, the information is in the chat. And as we said, there will be an info session on Friday. And we hope you'll subscribe to the Pacific College YouTube channel. We'll be back in 2022 with lots more exciting YouTubes. Thank you again to Shellie and to everybody. We look forward to seeing you next time.